Hi, my name is Allie, my partner is Abby, and today we will be discussing neutropenia and cancer. While I did not encounter a patient under neutropenic precautions or who was receiving cancer therapy in the clinical setting this semester, I did have a patient a few weeks ago at work who was under neutropenic precautions. She was in her mid-60s and was receiving chemotherapy at the time. Because of her treatment, her white blood cell count was so low that there was a very large risk of infection, hence why they put her under the neutropenic precautions. While I don't specifically remember what her vital signs were, for a patient in her condition, the nurses may see an increase in heart rate, respirations, temperature, and a decrease in blood pressure. Any vital signs out of the normal range should be addressed as soon as possible, and vitals should be monitored at least every 4 hours. A huge indicator of infection is temperature, so specifically keeping an eye on that might be a good idea. The patient had a history of cancer and had been struggling with leukemia for years. She was a full code, had no allergies, and was a P1 pivot with walker and gait belt to the bedside commode due to weakness. She also had a Foley catheter placed to help reduce falls and was a daily weight. Signs and symptoms of the condition which she did exhibit were fatigue, weakness, easy bruising, an increased temperature, and rapid weight loss, hence why we had to do the daily weights, as well as why there were so many precautions put in place for her getting up to use the bathroom. We didn't want her falling, we didn't want her getting weak or too tired too quickly. For a patient with neutropenic precautions undergoing cancer treatment, it is common to see an ANC of less than 500, a white blood cell count less than 4,000 cells per microliter, and a low platelet count, meaning there's less than 150,000 platelets per microliter. These are low levels leading to neutropenic precautions in hopes to prevent infection. Intervention strategies for this patient that would help ensure that there is less of a risk of infection would be that staff is promoting good hand hygiene before entering the room as well as after, donning PPE and appropriate gloves when entering the room, limiting the amount of visitors, and making sure that no staff taking care of this patient are sick. So no colds, no flus, coughs, anything like that. These patients get sick very, very easily because of that low white blood cell count. They don't have a strong immune system, so all these things are super important in making sure that your patient does not get more sick because they do get septic very easily. With this patient specifically, she was also receiving chemotherapy, so the proper chemo gloves had to be worn when entering her room. Overall, these patients need to be kept away from other patients. We really want to try to limit that risk of infection, and staff should be aware of vital signs, signs and symptoms, and just keeping a very, very close eye because these patients do tend to go downhill quickly if they do get sick.
After looking at interventions for this patient, we'd really want to hit home on the patient education. A main topic of education for a cancer patient who's also neutropenic, we would want to focus on the risk for infection. For a cancer patient, infection risk is a huge priority, and we can do a lot with the education towards the patient. One way we can do this is preventing the introduction of new bacteria. We can do this through limiting flowers and other fresh produce into the patient's room. We can also do this through diet restriction. We'd want to encourage the patient to eat foods that are like frozen vegetables and frozen fruit to prevent that fresh bacteria. And we'd also want to encourage the patient to not be involved with uncooked meats and fish, and that if they were to eat meats and fish, that they would be fully cooked, as well as eggs. We'd also want to encourage that high protein, high caloric diet due to these restrictions to make sure they're still getting the proper nutrients that they need. Looking at the education with this patient, we'd also want to educate on the need for emotional support for this patient. We know that cancer treatment can be taxing in multiple ways, including that emotional, physical, and as well as physical support. And so that we would encourage the patient and the patient family, friends, or support system to heavily be involved through this treatment. Looking at the American Cancer Society, we can learn a few things about how to care for a cancer patient. Again, the major risk for infection is a huge concern here. Using the hand hygiene, limiting the visitors, and limiting the exposure to more bacteria or infection, decreasing that infection risk is truly the main priority. And we can do that through encouraging vaccines for the potential visitors, as well as cleaning precautions and preventing the patient and viruses in the room, as well as where they go about during their days. For this patient specifically, we see that infection is a huge risk, and this patient has a indwelling catheter. And we want to strongly encourage the hygiene and the cleaning with that catheter. But we also know from the American Cancer Society that the multi-drug resistance is a concern, as well as acquiring C. diff. And for example, if this patient were to get a urinary tract infection from this catheter, the patient would be placed on an antibiotic if they weren't already. And with the antibiotic, it can help fight the infection, but could also throw off the microbiome in their inside and the internal, and causing C. diff. And typically C. diff can be treated with a probiotic as a bacteria, but due to their neutropenic state, we wouldn't want to introduce more bacteria. So managing that risk and for infection and new bacteria. So again, that infection risk and also that emotional physical concern we see is a high priority for this patient. Thanks.